Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be discussing how insurance professionals working with providers at this point in time of the year is a great opportunity to establish not only a strong ending to the annual election period, but a great way to set yourself up for 2023 utilizing this marketing initiative. You'll notice in the software package that there is a section for both questions and chat. We ask that you put your questions in the questions box. We do find that most times we handle many of those questions through the course of the presentation, but we want to make certain that you receive full value out of the investment you're putting in viewing this presentation. And we will make certain that we address those questions that we may not have answered through the presentation itself. We'll be spending the next 50 to 60 minutes discussing this topic. And once again, we thank you for joining us. Since this presentation is directed to agents with different experience and relationships with our organization, we'll be doing some level set through the initial part of the presentation. And keep in mind, many of the regulations that are noted in the presentation from the Medicare Marketing Guide will be there for your reference, and we won't be going through everything line by line. As a beginning of our presentation, let's give a little level set about who Premier Marketing is. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We're licensed in all 50 states. We act as an insurance wholesaler working with independent insurance agents such as yourself, offering contracts at the highest possible commission levels with recruiting contracts available to those who qualify. We do so through a full portfolio of products. These are crucial offerings that are necessary to really develop and maximize our relationships with providers in the community. And we do so through those Medicare programs, the Medicare Advantage, Medicare supplement plans, and the standalone prescription drug programs, but also through life insurance and final expense life insurance, pre-need plans, long and short-term care programs, disability income programs, and ancillary benefits that address specific additional needs above and beyond what is offered in the base medical programs that our prospects and clients select. Those Medicare Advantage plans include the national carriers and many of the strong regional carriers that make a difference for you in your market. And the same philosophy carries over into the prescription drug plans. Many of these are offered as part of that MA contract. A couple of exceptions. Mutual of Omaha is a separate contract for their PDP program from their other offerings, and CleverRx is actually just a discount program. Those Medicare supplements, strong portfolio, the national leaders are there for you through our organization. And this can be a key component when we deal with physicians, especially as well. And we'll explain that in greater detail as we go through the presentation. Those ancillary products include the leaders in the different categories, a great way to help us market in a different fashion with additional approaches available, and can be crucial for some of the carriers in certain areas that enable us to go above and beyond, once again, those base medical coverages. So when we look at the Medicare opportunity, what we have with these programs are an opportunity to reach into the Medicare community if it's based on age, based on the Medicare recipients that may be deferring that coverage for one reason or another. But it's also a great way for us to reach that under 65 population that's so difficult to define in other marketing opportunities. And the challenges that Medicare beneficiaries have in being willing to do an annual review is actually an opportunity for us to address the provider's needs to make certain that their patients are accessing the best benefits that are available to their prospects and clients, or to their patient base, I should say, and your prospects and clients. That same philosophy deals with the folks that are in perhaps a Medicare supplement program or basic Medicare and just picking up those prescription drug plans. So it gives us that opportunity to make certain that we are laying out details that can help our providers in the community, regardless of those base programs. We want to do so in a fashion that helps us communicate properly. So we have an acronym guide to make certain that we are communicating not only with the folks we visit with about their coverages, but the providers that come into play as well. And this gives us then the reminder that if we limit the acronyms, we're going to do a better job of communicating with folks all around. And we keep in mind that because of the choices that the population that we serve have, it gives us then a way of approaching different providers in the community with an approach that is suitable for their patient base, or in some cases, the people that visit them for delivery of care. It gives us then a way to expand our mindset when it comes to approaches that are through a true center of influence in the community, and gives us a way, once again, of touching people that aren't responding to the multitude of TV commercials, the pile of direct mail that they have on their table, whatever it happens to be. It's a great way for us to deal with a provider of care that is an incredible, important point of influence to the patients. And so if we look at the reputation that these providers have, they have great satisfaction with the people that are accessing the care. And so it gives us then a de facto way of an endorsement from these providers if we work in a fashion that aligns ourselves with the mindset of these providers of care. We want to make certain that we also keep in mind that some of these providers may well be potential prospects and clients for us as well. And this may be because of the under 65 offerings that we have as part of our portfolio, or keep in mind that many of these providers are on Medicare themselves. And we want to make certain that we're delivering a message that can influence their decisions as well. Why are we doing this at the end of AEP? Some folks may be saying, well, keep in mind, there's a lot of activity going on that's going to affect the patient base of these providers. That may well be prepping them for new patients as they come on board, because some of them may already be calling these providers to set up appointments after their effective date, or they may learn of some of these new patients through the list that may be sent to them by the Medicare Advantage carriers that they work with. It is an opportunity for us to make certain that we are a point of reference. We are a strong partner with them to help them understand the new coverages, these being those new patients, or making certain too that we alleviate the pressures that this can put on these different provider offices. And it may well also apply to some of their current patients that are changing coverages, or remember, Kaiser Family Foundation will tell us, and it'll be illustrated in just a moment, that over 70% of the population, while they don't review their coverages, we can help them understand their ANOC, their annual notification of coverage, and the possibilities of utilizing special election periods if there is other coverage that may well be better suited for them. This activity now and through the end of the year helps set us up for the rest of this marketing period and marketing periods moving forward through 2023. These docs, well, gee, you go to your doctor, you trust them for advice, and it includes some of the benefits that they have that can alleviate pressure for some of these physicians. We see in many of the Medicare Advantage carriers a strong addition of social determinant of health benefits that may include transportation or other things that can alleviate some of the challenges the beneficiaries see in their lives throughout the year. And this then, through an explanation to that patient base, helps alleviate some of the pressures that that office may have, well beyond transportation to make certain that they actually follow through with their appointments, but also a representation or an explanation, I should say, of their benefits that include prescription coverages and the costs that are incurred when they access care through these physicians. That can make a huge difference and can be strong reasons why a doc will do business with us, in a manner of speaking, because we help explain those coverages and their patients know what they can expect when they visit their doctor. Same thing goes on with providers that are in pharmacies, a pharmacist, of course. And this is, of course, a strong marketing initiative that enables us to carry through with many of the agents that are working in retail initiatives now. It's so important for us to remember that that opportunity doesn't end December 7th if we have set ourselves up for the remainder of the year. So much like doctors, pharmacists are some of the folks that see the folks that are new to an area or aging in throughout the year. And this gives us that opportunity to address those throughout the course of the year and make certain that we can level out the peaks and valleys of our enrollments in any selling period. Dentists. You'll notice in many of the offerings that have come about with Medicare Advantage programs, particularly, well, these folks, we see an increase in those dental benefits. And if we are working with a Medicare Advantage program that provides us then that listing of the network of dentists, we have additional professionals that we can approach, help explain those benefits that are available, and it may well include folks that are in their current patient base or folks that we can help them understand that new patients coming in because of those dental benefits. It gives us then that opportunity to make certain that the explanation of those benefits doesn't fall on the staff of that dental office. We've got a couple of other providers of care too that in certain circumstances can be a bit of a nemesis for us in maintaining retention of new enrollees. And these include durable medical equipment providers and home health agencies. So if we see those folks that are part of a network, it gives us an opportunity to help explain those benefits year over year and how that can still be an advantage to a DME or home health agency provider. It's a great way for us to reach out into the community and drive persistency through explanations of these providers. Hospitals. Some of the challenges we've had in the past, a lot of times a patient will go in a hospital with coverage, and upon their release, they may be, finger quotes working here, counseled by social workers that will disenroll them from our coverages. Working with those social workers so they understand the benefits that are available through these plans will give us another marketing opportunity as well. And we have to keep in mind, remember that many of the hospitals have support groups for folks that are prospects for us for special needs plans moving forward as well. And so this can be a strong way of reaching beneficiaries that don't understand their coverages or may be confused by the, once again, finger quotes working, helpful counseling by hospital employees. Where do you find these folks? Well, you guys know. If you're working in the Medicare Advantage world, the provider listings are there for you. Working in an HMO program, it's a solid list of providers. Working with PPO programs as well, that gives us an opportunity to reach into additional carrier payees, I should say, that are receiving compensation even though they're not part of a formal network. We can also find them in a multitude of other areas that may well give us the opportunity to see providers that are looking to expand their benefits. So going on the internet and utilizing yellow pages, well, if they're advertising in those publications, that may well give us an opportunity to reach out to providers that are looking for additional business and maintaining the patient base that they currently have. So some different ways that we can find these individuals, these providers, and how that can make a difference for us in our activities reaching into this community. Some of the basics on what you do with these folks and how you can reach out to them are some of the things that you have had success with throughout your sales career. Doing things professionally, smiling, not ignoring any of the folks that are part of an office. We can't overlook the people at the front desk. We've got to make certain that the insurance counselors in some of the offices understand what's going on. And we want to make certain that we do so in a fashion that we are an asset to that office as opposed to an interruption or an inconvenience for these folks. We can do some things that can make a big difference in our accessing the folks that make the decision by being of value to the gatekeeper as well. That person at the front desk, that may be the individual that is the factor in if we're whether or not we're successful in reaching out to the people that we need to speak with about establishing that relationship and being consistent in our activities to make certain that these folks know we're there for them. We're going to be there consistently. And so that requires consistency on our outreach as well, and doing so in a fashion that helps these people remember who we are and what we bring as value to their office. Basics, once again, working through the folks that have different responsibilities in that office, addressing them by name, smiling and being professional. It's a great way for us to work through that staff, be it a solo practitioner or folks that are in an office that has multiple physicians or a clinic. Working with those folks gives us an opportunity to make certain that we are going to receive folks directed to us one way or another. It's also important for us to know that we don't have to carry the full ball with the challenges that offices may be encountering, not knowing what changes are, or having difficulties with a carrier if it comes to payment or something of that nature. We want to make certain that we're delivering value, and if that office is growing and they aren't aware of some of the marketing opportunities they have in the community, enlightening them of the schedule of that activity because you're involved in it as well. It's important for us to make certain that we understand those providers and what their philosophy is in working through the attainment of additional patients. Or what are we doing to help them keep their current patient base as well? It is an opportunity for us to make certain that we understand how that provider is affiliated with a certain health plan. So working the affiliations that they may have with an IPA or a medical group, well, that can make a big difference, and it may help us in finding additional opportunities through those affiliations as well. It is also an opportunity for us that, okay, John, why are you talking about this toward the end of AEP? We've got other things we need to do. Well, the approach we have now is going to be different than some of the approaches that we have as time goes on, because once again, these are folks that once we're into the OEP and lock-in periods, we look for the folks that qualify for those special election periods throughout the year. If you look at those multitude of SEPs that are out there, those special election periods, the majority of people on Medicare will qualify for one or the other. The question is that of their best interest to do so? That then can make a difference when someone will recognize the expertise that we have in those circumstances. Are we able to help them understand the extra help programs, the low income subsidy, LIS programs that can make a big difference on whether or not a patient stays on a medication that has been prescribed for them? Do we understand how we can help people qualify for Medicare savings programs, those MSPs, that can alleviate some of the financial pressure of the health plan itself, and quite possibly enable us to offer special needs plans addressed at that population? And that can make a huge difference, not only to that patient, but to that doctor's office. You don't have to write off unattainable, or the word I'm looking for, it's escaping me for some reason, but the folks that can't pay even a copayment. Well, there's a reason for our offering our services for those Medicare savings programs, because we can help eliminate that. And knowing some of these other benefits, such as transportation benefits, well, that helps us make that provider realize that that's going to help them maintain the appointments that are set. So their patients are going to come in when they're scheduled, because they can actually make it on a consistent basis. We want to make certain that we're doing what's best for the patient and for the provider, tailored upon their specific situation. We also want to realize that not every provider in the world is part of a network. And those providers that are not part of the network need our help as well to maintain their patient base. So this gives us an opportunity to leverage our contracts with Medicare supplement programs and the PDP programs that we offer, those standalone prescription drug plans that can make a huge difference for these providers throughout the year as well. It helps them maintain their patient base. We, once again, take all of our experience and we help these providers, whatever their specific situation is, to maintain their patient base and grow the practice if that is their intent. Doing some things old school. Well, we have the opportunity to do Zoom meetings with providers, or virtual presentations with the office staff to train them on different programs. But some of the simple old school pieces that can differentiate us from everyone else that's looking for the same opportunity may be as simple as sending a handwritten thank you note. That can make a huge difference. It differentiates us. It gives them also our contact information on a repeated basis and gives them the opportunity to properly communicate with us as well. We want to make certain that they realize that we are driving patients to them, and we are doing so through the application process with the different products that we have available. This gives us then an opportunity to once again differentiate ourselves from the competition. I had a doctor in one of the very competitive areas in South Dallas that I called, and simply, since you couldn't talk to the doctor on a consistent basis, I'd leave him messages. I want to thank you for taking care of my clients that are your patients as well. It's amazing how that simple message created the beginning of a beautiful relationship with that provider, with that doctor in this circumstance. And we can elaborate on that as well when we visit with the staff and make them aware of, here's the folks I'm driving to your practice. I can be a point of contact for you for helping your patients understand their benefits if they have questions that occur. Because you realize that you can tell some people the same thing a half a dozen times and they'll ask a seventh. And sometimes that seventh inquiry is to the provider. So you can alleviate that pressure from the staff as well. So some of these different pieces that we have right now are from the Medicare Communications and Marketing Guidelines that are issued each and every year. It gives us then the idea of, or the knowledge of, what we can do compliantly. It's particularly important if we have a new provider that's affiliated with a plan, and we can be there for them to help understand what the benefits actually are and how they can reach out to their patient base and announce that affiliation. And you have letters that go out there that can be compliant, that can list you as the point of contact for that new program that they are now involved in. We have also an opportunity to make certain that they understand what they can and cannot do in reaching out to their patient base. We want to make certain that they understand what they can say in those letters. And we have help from our carrier partners to make certain that that information that is being sent is kosher, in a manner of speaking. We also want to make certain that they understand what documents are available for them to distribute and how they can distribute them. The new normal we have has a lot of that information going out electronically, not so much by the United States Postal Service in many circumstances now, and we want to make certain that they understand what they can and can't say in that communication as well. We also want to partner with those docs to grow their practices, and sometimes that involves having them available in different distribution of the marketing plans with whom they're contracted. It's important that they are very careful in the comparisons that they can do with the different carriers. But hey, as contracted agents with Premier, you have an opportunity to use Medicare Center and compare the top three plans that they're offering through the discussions we have with their patient base, being compliant, gathering the scope, making certain that all that detail is there. We're adhering to the recording of our telephone conversations. Thank you, Joe Namath, J.J. Walker, all these William Devane, these so-called TV personalities now that have made our life a little more complicated, but we can take that out of their hands. And it's important for them to realize that one of the key components in our ability to do so is they cannot accept enrollment programs, but we can. And we can do so electronically through the use of that system as well. When we look at providers in the community that go beyond doctors, well, for many folks that are involved in retail, involved with marketing with hospitals, even long-term care facilities, we're able to do some things compliantly and alleviate that pressure from that provider. We understand the guidelines that are part and parcel of what we can do and say in helping get that message out to the community. For you folks that are involved in retail, please, please, please don't think that that opportunity ends on Pearl Harbor Day. You're not blowing up ships. You are tweaking the approach that you have for folks that are accessing their medications at that pharmacy. And keep in mind, as we mentioned before, you have new prospects rolling throughout the year, new to the area, changing pharmacies, whatever opportunity there is for us to identify new patients in that area. They qualify for that special election periods, one of them, whatever it happens to be. Well, that gives us those additional prospects for us to visit with. It is also important for us to make certain that providers are aware of what marketing activities prohibition applies after hours in those settings. So we want to make certain that they understand much of that responsibility can basically be shifted to an agent who knows what they're doing and doing so compliantly. So we want to make certain that that is there and that the providers realize that we're doing a service for them to grow their panel, keep their panel in place, and we're doing so without involving any unscrupulous compensation that may come with that opportunity. We want to make certain that the providers understand that they don't know all of these programs like we do. They don't understand the medications that may be necessary to be changed because of a formulary or simply because there's a medication on the plan that they're now enrolled in that is handled differently within the formulary benefits of their new program. We're there to help them understand these benefits specifically, and it's one of the reasons why there are prohibitions for doctors to explain plan preferences and differences, because they don't know everything about the entire package. Back in pre-MIPA days, we had carriers going out there and visiting about just one benefit. It's why we're subjected to some of the MIPA regulations that we have. Once again, we're paying for the sins of our brethren, and sometimes that sin was committed by providers as well. So we want to make certain that they realize they can't switch or steer plan employee or enrollees, but with the programs that we have available, we can help them thoroughly explain the benefits that are available to them and do so in a compliant fashion. So some of the things that we might like to see these providers do for us, they can't. They can't call their patient base. They can't accept enrollments. They can't do certain things when it comes to mailing. We want to make certain that they understand the value we bring to help alleviate them from these different compliance pressures. We want to make certain that they understand that there may be an opportunity for them to provide information about low-income subsidy or Medicare savings plans, but they may not be in a position to provide that information with the different changes that come about in those programs, the copayment differences year over year, and actually the time and pressure that it puts on their staff to help explain those benefits to their panel and alleviate the time that's spent in the application process as well. If we do that for them, we're not only providing that service, but we then are in control of that process and are part of a legitimate communication opportunity with those patients. It's also important for us to note that some of the responsibilities that we have with new regulations brought about by some of the, I'm going to call it egregious marketing techniques that some televised folks will do, they realize that we may not offer all of the programs as well. I don't know of any agent that is contracted with every provider in their market, because if nothing else, outside of the time and the pressure and the things you have to go through in order to make certain that you can offer those programs, some of them aren't available to the broker community. So some of the natural things that we talk about when we discuss the different options that are out there may well be part of a compliance issue or compliance requirement, but it is also a way for us to winnow down those different choices for those beneficiaries and help them realize that some plans just are better for them, and we can do so in a compliant fashion. It's also important for us to make certain that these affiliations with the different health plans that are part and parcel of their participation, they're in the network. Well, this gives us an opportunity to visit with different offices because they may be displaying material with one or two of the carriers that they're contracted with, but not with all of the carriers with whom they're contracted with. If we're able to identify that and we are contracted and certified with additional carriers, we can help provide that information to those offices, and it gives us the entree into a relationship with that provider. It's also really neat that as we roll into lock-in, we have the opportunity to speak to those special needs programs, and that gives us another way of being a valued service for the providers. A lot of them, they don't know the difference between a chronic special needs plan. They know some differences with dual special needs plans sometimes, but they don't need to. We do. And that gives us the opportunity then to once again alleviate that pressure of knowing some of those differences, not just with the provider, because they depend on their staff a whole bunch of the time, the majority of the time, but it takes that burden off the shoulders of the staff so they can do other things that are of value to that office. We want to make certain that they realize that we are a source for all of that material that's necessary. Now, they don't have to reach out to a carrier if they don't have that material, but if we identify it and we bring in that material, they then have to display it. Once again, you're setting up that relationship and making it work. So we want to make certain that the staff realizes what we're bringing as value, and we're being consistent with our follow-up to that office to help them understand what we're doing for them, and that we remain in their line of sight as that valued resource. We're going to run into some folks that have had challenges with certain carriers for one reason or another, but you don't have to be the answer to all of it. You just have to know how to use that carrier's provider services department to alleviate and eliminate the challenges that are there. That gives us also a great way for us to differentiate ourselves with carrier representatives and how that might enhance our relationship with area agent managers. Why do we care? Well, they're a great source of information, but they may well be the folks that are controlling leads that that carrier generates. And it can snowball into a deepened relationship where we then are the folks that are going out on appointments because of leads that are furnished to us by the carrier themselves. It's all part of being a professional in what we do, acting in that fashion, building the trust, doing so through follow-up, and we're going to earn that respect that is necessary for us to do things on a long-term basis. Remember, this isn't a one-shot pony. We want to make certain that we're able to deliver month after month after month and receive prospects month after month after month. When we look at pharmacists, same sort of philosophy carries into play. You have to, in some circumstances, deal with corporate, but being a person that's on a number of medications, God bless America, I stand in line a lot of times at pharmacies. I've never heard one of the farm techs talk to an individual who has to say, I can't afford the medication. They stand there and they stare at the individual, and they don't speak to low-income subsidy. If we establish ourselves as a subject matter expert for those low-income subsidies, that extra help on the prescriptions, that farm tech then is made aware of that service that we can offer, and then all of a sudden, we've got additional leads coming out of that pharmacy. If you worked in retail now, in retail opportunities now, by golly, I hope you established that benefit that you bring to that pharmacy as you start that pharmacy opportunity, that retail opportunity. And that continues throughout the course of the year. So you're going to deepen that relationship. And I have many agents that I've worked with in the past that, okay, I don't work that pharmacy every year, or I haven't. They're still sending me leads. That's because they respect what you do and how you do it, and the knowledge that you have to make it easier for their staff as well. It gives us then the opportunity to free up the administrative tasks that are put upon that entire department, and many of the tools that we have in a marketing scenario, well, they can apply to a pharmacist as well as a doctor, be it a doctor or a specialist or whatever. And those pharmacists, like the doctors that we're dealing with, may well be folks that we can help with their insurance needs, because we offer a full disability or a full portfolio of product moving forward. Don't let it go December 7th. Continue to work that market venue program, and then look at some of the other providers in the community. Dentist. I talked about how dental benefits are being pumped and really spoken of in marketing opportunities. Well, there are certain carriers that also have specific marketing opportunities for their programs with dentists that are part of their network. That gives us a great opportunity to reach into the community in a fashion that's different. We're not all chasing primary care doctors. We're working with dentists as well, and these dentists have personal protection needs as well. Our portfolio, once again, a product that we offer can help us with the dentist, in addition to the folks that are accessing care through their offices. And think about it. There are a lot of people on Medicare don't have any dental coverage. Not everybody is in an MA plan that offers dental coverages. And many of them, if they're part of a Medicare Advantage program, well, it may not be enough coverage. And the standalone dental programs that we have as part of our portfolio can make a huge difference in helping them with the cost of their dental care. You even have some of that same circumstance come into play with dual eligibles. Well, gee, John, they don't have any money. That's why they're a dual beneficiary. Well, they may have family that is very cognitive of the fact that there is a need for dental work, be it extraction of teeth, different things that can be very expensive for them, dentures. And these programs then can help alleviate pressure that the family would have in making whole the coverage for dental coverages. There are also, of course, the standalone programs that are intensely marketing this particular need, and the standalone programs can make a big difference for you. And you are probably very well aware of the fact that they are becoming very competitive as well. It gives us then the opportunity to have another lead source because of the coverages that we offer. And we can do so in the fashion that the folks want to receive that information. It may be in person, it may be a virtual experience, or it may be a hybrid combination of the two. We have the programs that are now being more readily accepted because of some of the training that's taken place for these folks because of COVID or the pandemic or whatever you want to call it. But they are then able to then be part of an electronic process. So this is where we have the opportunity to do some things to fully protect our new clients, or for someone who, well, they went someplace else for something else, we can then reapproach them with another product that suits a need that they have. Remember, they've been trained by their doctors, they've been trained by hospitals, they've even been trained by dentists to receive information in this fashion. So if we're being honest and respectful and we're being of value to the patient and to the practice, we're saying thank you, we can be that subject matter expert for these folks now and throughout the year. We ask that you do some of these support programs through our organization, because there are certain things that we're going to be able to offer to help make it easy for you. Contracting with multiple ancillary carriers, well, you can set up an agent profile and do some things electronically and make it simple to once again do things very quickly through these systems. It's a great way too for you to store all your information that you need with different carriers. We do offer discounted errors and admission coverage for qualified agents to make certain that they're being protected legally as well. What makes you a qualified agent? Well, you got a contract with us. This is a program, however, that you own. So it's not like being added to a blanket E&O for one program or another. It gives us the opportunity to provide this requirement from different insurance companies, regardless of whom you contract through. We're a huge organization. We don't offer every contract with every carrier in every market. It's about as difficult for us to do so as you to contract with every carrier in each of the markets that you pursue as well. This satisfies that requirement for contracting with those different insurance companies. We do also offer discounting continuing education to keep your license in play through our relationship with WebCE. And you have an opportunity as well to add to your own benefit package through a modified guarantee issue disability income program on yourself, where you're paid a commission on that product. Much as where today's presentation is being recorded, past presentations have been as well. We spoke of at the beginning of the presentation how they're available on our website and on our YouTube channel. But this gives us the opportunity to go in and look at different explanations of approaching providers, approaching faith-based organizations, doing things with specific carriers, looking at certain niches within the insurance world, and doing so through a process that makes these available for you 24/7. Much as where I enjoy folks coming on to the live presentations, we all have schedules, we all have life that goes on. We want to make certain that you're accessing or have the ability to access these presentations and how it can help you throughout the year. This is the program I referred to earlier with the comparison programs that we can do compliantly. But this is a tool made available to contracted agents in the vernacular of J.J. Walker, free. I don't have that on one of the bullet points. I really should have that first and foremost. But you have access to multiple quoting engines. You can do those side-by-side comparisons compliantly. You can collect that scope of appointment through multiple efforts and have it stored for that 10-year period, whether you sell that individual or not. Keep in mind, you gotta keep those on file if you do or not. And that same sort of benefit comes through with this new requirement of call recording. Those have to be stored for 10 years as well. Keep in mind the space that's got to take in order to make certain that it sticks around for that 10-year period. Many agents are really, really active, so they're going to have a lot of conversations. It's going to take care of that storage, so you don't have to worry about that either. You have also a PURL, a personal URL, a microsite that's provided to you through this tool. And even if you have a website on your own, you can link to it. And it's a great way for you then to send people that want to do a little bit of homework on their own to look through the different programs that you offer and possibly enroll on their own. And you still get the credit for that sale and the commission that comes with it. It does have a contact database for you, so your drug comparisons year over year, that review becomes so much simpler for you. And it has the ability to earmark through switcher tags the folks that are probably most susceptible to change. Not just for you, but those are the folks that may be pursued by other agents. We don't want to keep them in our book. And there is a new program that's come out as well, the Lead Center, where you have an opportunity to purchase leads through different sources through this program, and you can do so through a live transfer or through leads that are sent to you in writing. You control the number of leads, the investment that you want to make, and it's a great way for you to fill in your schedule and make certain that you are maximizing your sales opportunity day after day, week after week, sales period after sales period. It also has within it different resources through the Learning Center that may give you hints and tips on sales scripts, outreach for folks for dental programs or Medicare supplement plans, a great way for you to keep in your mind a refreshment of the skill set that we have through experience. And it is, of course, also offered to you as a mobile application as well. There are different programs too that offer incentives, different marketing dollars that are sent to you above the commission that you earn that can help you qualify for carrier trips and incentive programs through our organization as well. We brought back our sales trip, and it gives you also the opportunity to qualify for different support programs in the marketing arena. That contact list. Well, if you are cold calling for a particular product, we want to make certain that the list you're using is compliant, so it's butted up against the do not call list, as opposed to the 7 calls I've taken today already from different call centers offering to help me with my Medicare decisions. I'm not on Medicare. I don't qualify for it yet. But this gives you an opportunity to approach people for med subs, dental programs perhaps, final expense even. It's a great way for you to reach into the community and do so compliantly. We want to make certain that we're also delivering upon information that helps you be successful in retail marketing, in marketing with faith-based organizations, and working with providers, much as what we've talked about today. Some carriers will generate prospects for you. These are generally MA or PDP carriers that are a quid pro quo situation. You're scratching their back, they're scratching yours. A lot of that is controlled, as I mentioned before, by agent managers in specific markets. We want to make certain that you can access those leads should that be available to you. We do have internet lead programs available, direct mail support, a really cool T65 locator, and a referral program that reminds us to work consistently and asking for referrals, but doing so in a fashion that doesn't make us come off as some sort of shyster, pressure-filled, oh, give me your names type of situation. That direct mail program is production-based, and it's through an opportunity where you can qualify for $2,000 worth of lead at deeply discounted programs based on your production in health insurance and in final expense. But we're doing so you have an opportunity to do this consistently. That's where you see the value on a mailing program. It's done through vetted lead vendors. We want to make certain that their systems can provide you the tools that are enabling you to reach people very quickly, and it gives us also an opportunity to vet their outreach so we all stay in compliance. We have a partner also that helps us with direct mail that's never been touched, fresh mail. And these costs will vary from area to area, time of year through time of year. This is as high as I've seen these costs, but that is available to you to fill your schedule once again as well. That lead center. Boy, guys, gals, you got to investigate the opportunity you have in this area to get leads through a system that you're working to sell people. It's starting the process for you. You can turn it on and off. You can limit the number of leads that come to you day after, throughout the day, throughout the week. A really cool way of making certain that you have people to talk to who are interested in what you're offering. The internet leads, it's through a program we have with a vendor for Facebook leads, one there in play for final expense, one there in play for leader from Medicare as well. It's important for us to realize that this is a microwave lead and they expect a microwave response. One of my friends noted that she received a request for leads at 2:30 in the morning. And when she reached out to them at 6, well, you didn't answer me right away. I went with someone else. It's that mentality that is in play with any type of lead solicitation because, well, they may not have been contacted or they may feel that you didn't reach out to them fast enough. We want to make certain that we realize the urgency of maximizing the value of these leads. At T65 locator, well, if you're stacking face-to-face appointments in a particular area, one cancels on you, you got 4 in a row, number of 3 cancels on you, man, I'm tempted to go home. 4th one I can reschedule. Well, don't. There are some things that you can do in that community where you can approach them compliantly for other products that help you fill your sales funnel. You can go in there, hey, I've got a dynamic new dental program that's being made available. Oh, I'm only 63. I'm not on Medicare. My husband is still working as well. My wife is still working as well, whatever it happens to be. Well, the earlier that you enroll in these programs, they pay in addition to what other dental benefits you may have. And the younger you become involved, like any insurance program, in life insurance and some of the other programs that I offer, well, you're going to get it cheaper if we do that. So it's a great way to fill that sales funnel that way. I keep talking about that referral process and how it's important as we prospect and sell, but it is also a way to keep your book of business involved with you. It's very important for us then for contacting our current book of business to keep them in play, but also they're satisfied with your services. They're more likely to send people to you, and it may be as simple as Pepe Le Pew and Penelope. You don't get kissed if you don't ask. We're asking. We're doing it consistently with our book of business as well. It also gives us a way to present programs that your book may not have in play that we're using as a referral ploy in a manner of speaking. You know, I really appreciate the fact that we're doing, I'm helping you provide the medical coverage that you have. I know that some of your friends may be interested in additional dental coverages. You know, folks that I can help in that arena. Why aren't you asking me? Well, you just asked me. I can provide it to you as well. We want to make certain that it gives us then that opportunity to have an increased retention with our book of business, because studies show the more product you have in place, the harder it is to replace you as their agent. They don't have to be with the same carrier. They just have to be with the same agent, and that's you. So that said, we do all this because we want your business. We want to be referable to you with your agent community that you work with and that you're familiar with anyway. And we want to make certain that we can be that source of power behind your marketing and sales initiatives. These programs, particularly when we talk about working with providers, you don't have to certify for it. There are some carriers that ask you to do modules for community activities, but if you're approaching a dentist, that doesn't happen that way. You can put these in play immediately. Simply do a little bit of study, have the product that's there, and if you're in an area, and once again, you don't want a door knock utilizing that T65 locator, well, it gives you the opportunity to walk into a dentist office and say, hey, these are some of the things I can help you with for your practice. A great way of adding on immediately as another marketing initiative. So all that said and done, I want to check quickly to make certain that their questions may be covered. Yeah, things to either talk you to sleep or I covered everything very well. I want to thank you. I want to thank the folks that have been working with us here at Premier. We thank you for that business. We want to grow that relationship as well. And through some of the programs that we offer that you may not have considered in the past and may be looking at differently because of the marketing opportunities you have, well, we can help you. For those of you that haven't done business with us in the past and are looking at this as a bit of an open eye, well, I thank you for that opportunity. But I really thank everyone for taking the time to view this presentation, be part of this webinar, because it takes your most valuable resource, and that's your time. And I've talked much longer than I usually do on these. I thank you for that extra time that you are putting in with us. You can reach us through our toll-free number, 1-800-365-8208. You can also reach us through our website. And if you're working with a marketer now, they may well be reaching out to you to see how we can engage this part of the marketing initiatives that are available to you and put it in play quickly to have it be a valued part of your marketing moving forward. So all that said and done, until we're able to visit with you again in the near future, I wish you good selling. Thanks so much. We'll talk to you soon.